Welcome back to Mike and Gina in the morning. The show brought to you by Gene Langley Ford in Humboldt. 741 right now. Still lots of sunshine downtown Jackson. We are looking at a temperature of 54 degrees right now. A text from the Gene Langley Ford text line, 277-5155, talking about the insect in the car.
Yeah.
This one says, don't worry, I'm sure that wasp would still find its way back to my house no matter what I did. I can never get rid of stupid things.
Yeah, they're kind of mean, too.
Yeah, they're frisky.
Yeah, spicy.
Well, I've never eaten one, so I wouldn't know.
I mean, their little attitude,
Oh, yeah, they all got tubes, no doubt about it. All right, we don't have Dr. Love in here. Well, we may. I don't know.
We don't know. It could be.
Dr. Mike, now, is it Revelle or Revelle?
Rebel with a V. You're in the South, so it's Rebel.
Rebel.
Yeah, there you go.
With a V.
He's a rebel
That's
without
right.
a cause.
That's right, or a clue
Rebel.
sometimes.
Yeah. He actually does have a cause, or do have a cause, or whatever. We don't do English on this show, Doctor.
We don't do grammar, basically.
That's
saying.
all right. I'm from around here as well.
Yeah,
so
we do redneck.
We do redneck. We do.
Dr. Revelle, again, is with the West Tennessee Healthcare. And we're going to talk about telemedicine this morning. So how did you, number one, how long you been a doctor?
I've been at West Tennessee Healthcare since 1999, so a couple of years. Yeah, 27 years.
Wow.
Yeah. In June, I guess. Yeah, in June it'll be 27 years.
You're a local dude too.
Local guy, yeah, from Crockett County, Crockett Mills originally. And,
I know some Crockett Mills folks. Lisa Prescott.
Lisa Prescott I know well. Bull, who's I know a frequent caller.
Bull?
I hate to admit that, but I know Bull.
Is he a customer?
No comment.
We can't do that. HIPAA laws forbid this.
That's right.
Yeah, so you've been around the area, so you know a lot of folks. So you'll see some of the folks that come in that are local here as well. Tell me about telemedicine, because that's something that some folks know about, but they don't really understand how it works.
Yeah, that's right. Lots of good and bad with COVID that came along, and telemedicine actually was obviously present before COVID, but not widely utilized because we didn't, like you say, didn't understand it. But with COVID, needing specialists, infectious disease specialists, pulmonologists, other things kind of brought in to help manage patients. We needed the ability to. Most everybody knows what a Zoom meeting now is, and it's essentially that, where you have a doctor in front of you that you can bring into the room on a computer stand, if you will. We used to call them cows, but that's not politically correct anymore. Computer on wheels, but now it's a workstation on wheels.
Okay.
So we bring those into the patient's room and have the provider interview the patient and. Can make recommendations based on their interview. We even have the ability to place a stethoscope on the patient's chest, or using the camera, or even the otoscope,
Okay, wait, hold
or
the
looking
phone.
at the ears.
How are you doing that?
They've been inventing stuff, Gina.
Yeah, that's right. That's right. Yeah, it's pretty neat. Even some of our doctors now, even here locally, will have a stethoscope that's just a little. I'm using my hands and realizing I'm on radio, but it's a little.
You're on video as well.
Yeah.
So.
Okay, all right. So it's a little pad that they put on there, and it transmits the sound. And some of our fancy doctors just don't wear a stethoscope; they wear earbuds, the little earbuds, and you can hear the heartbeat, lung sounds, belly sounds, whatever you want to listen to, through your earbuds.
Okay, I just got an education right there.
Yeah, it's a similar type deal. So they can do that. They have cameras like on otoscopes. That's a fancy word for the thing they use to look in your ears, look in your throat. Depending on what the specialty is. But for our cardiology folks, obviously listening to the heart is good. We currently offer telemedicine in two service lines, cardiology and neurology. And so that the benefit is being out in the community where I'll just use Milan as an example. They have a general surgeon there in Milan. They have hospitalists there who admit folks to the hospital, plus our ER to see people. But if we have a patient that we're not sure, do they need to go to Jackson to see a neurologist or a cardiologist, or can they stay locally at that hospital and see that provider remotely, manage their care remotely? And patients are amenable to that. They'd much rather stay at home.
At home.
Yeah, and be there if they could, and get the same or similar services they would at the big house.
Right.
I'm sure that it comes in handy not just for the folks who don't want, but for the ones who cannot.
Yeah, who
ever
cannot.
leave their house. The elderly, the ones who where it takes a lot to be able to get them into a vehicle and get them somewhere.
Absolutely, and the $4 gasoline and things of that nature. It's it's taxing on the family, and so if they can stay there locally, wherever locally is, whether it's Martin, Paris, Dyersburg, Bolivar, Camden, all those places, they can stay there, and if we can keep them there, that's our goal.
What about things like strokes? Because I would think that would be kind of hard to diagnose over a tele situation.
Absolutely, you're right, Mike. It's strokes, heart attacks, things of that nature. You need an in-person neurologist or an in-person cardiologist. So we don't utilize teleneurology or cardiology for those type patients. So a stroke would be transferred. I mean, you need to be here. There's some services that aren't available, MRI, things of that nature at some of the affiliates, and so some of the affiliates do have them, and so we're working on trying to manage those. But for an acute stroke or something like that, the neurologist needs to see you in person.
Go ahead, Jim.
I was going to ask you about the ER locations. You and I, when you were coming in this morning, a lot of people don't realize that there's more than just one option.
Yeah, that's right. Jackson General is the busiest ER in all the system, and what most people don't realize is we're one of the busiest ERs in the state. So if you look at
did realize that
Memphis, Nashville, and things of that nature, you think, well, Jackson can't be big. Yeah, but there's 5 or 6 ERs in those cities, and here in Jackson we have 2. And so it's the busiest ER. So many times the other affiliate ERs aren't quite as busy. They can get very busy. That's the good and bad about the ER is you just never know what's going to walk through the door or how busy you're going to be. But yeah, we have 8 different ERs across the West Tennessee that we manage, and most of the stuff can be handled there. Everybody always complains that the ERs are full because people use it for a primary care, and there is some truth to that.
There's a lot of truth to that.
But I also tell people, if you have a sore throat, how do you know that's, sore throat can be bad things occasionally. Yeah. And so how do you know? And so we try not to fault the patient for coming to us for something that primary care could handle. But we do see a lot of things that we may or may not that aren't necessarily emergencies, but we're able to handle that as well.
Yeah.
When telemedicine first kicked into high gear, I remember because we had some folks on the show. They were talking about telemedicine or telehealth or whatever they called it at the time. But there are different companies that are not affiliated with the hospital that do kind of the same thing. But it was pretty amazing when they first started talking about it, because I thought, you remember back in the day, this is a long time ago, of course, we probably wouldn't remember, but when doctors made house calls.
I don't remember that.
Yeah, I guess this is kind of the next generation of house calls, right?
Yeah, absolutely. I mean, it's telemedicine or telehealth, as you mentioned, has been around for quite a while. Some companies will utilize that in their factories, have one person in a central location and have cameras and things set up where you can visualize the patient, talk to them, make visits. Not everything requires a hands-on physical exam.
Like turn your head and cough.
Yeah, that's
Can't
exactly
do
right.
that one.
No, it's hard to do that remotely, but. Other things for our cardiology folks, getting EKGs and ultrasounds of the heart, or echoes, as they say, listening to the heart with the remote devices that we discussed earlier. That you can get a pretty good idea of what's going on with the patient.
What are some of the main things that people are using telemedicine for right now instead of going to the doctor or the hospital?
Well, we're able to keep cardiology and neurology patients at some of our affiliates by utilizing that. So, like I say, if you think you're having a heart attack or you are having a heart attack, you're going to get transferred to where there is a cardiologist. But if it's vague chest pain, if it's something that just needs to be checked on, maybe get serial cardiac enzymes or something like that, the cardiologist could manage you there. Neurology, whether it be seizures or some other neurological complaint, it could be managed at an affiliate facility and not have to be transferred. We're looking at infectious disease as a big need. you're talking about specialties that you have not a lot of doctors of, so they can't go and visit all these affiliate hospitals, but they can be there virtually.
I've got a question.
Medicine.
Yeah, I've got a question from the text line,
Sure.
and I was thinking about this as well. Because I guess the number one question would be, what about getting prescriptions? Can those be done over telemedicine, or would they have to go to an actual doctor in person to be able to get that as well?
No, we can. I mean, you're still seeing a doctor in the ER, not just that person. And so, if there is a prescription that they recommend, to be given, or patients can even be discharged. They don't necessarily have to be admitted, but so they can be given that prescription. And in other telemedicine type things, yes, they can write prescriptions.
Awesome. Dr. Michael Revelle.
Yeah,
Again.
there you go.
There you go. Well, I was going to say it like 5 different ways. That way you feel at home.
Call me anything you want. Just don't call me late for supper, as they say, right?
There you go.
Doctor, if they want to find out more, is there some way they can find out more about telemedicine?
Yeah, we have a website. It's on the West Tennessee Healthcare website, I guess WTH.org, www.wth.org, and there's some information on there about services we provide, and, reach out anytime.
As well, they can go to talkinwesttn.com.
Yeah.
We've got a big
Excellent.
spread there for Talkin' Health, and a lot of Dr. Revelle stuff is on there, as well as podcasts from various doctors and
Absolutely.
everything that's going on there at West Tennessee Healthcare. Dr. Michael Revelle, thank you so much, sir.
Well, you're very welcome. Love to come back anytime.
Absolutely.
Yeah, we'll do it. No doubt. 7:52. We will wrap things up for this show when we come back.